For years, he looked at brain scans and told patients they had months to live. He'd perfected the careful language doctors use to discuss death. Then one day he was looking at his own scan. Stage 4 lung cancer, at 36 years old. He went from wearing the white coat to wearing the hospital gown in a single afternoon, and everything he thought he knew about dying changed. The cancer doctor's own diagnosis. Paul Kalanithi seemed destined for greatness. Stanford undergraduate, Yale Medical School. By 36, he was finishing his neurosurgery residency at Stanford, one of the most competitive programs in the world. Neurosurgery residency is brutal, 7 years of 80-hour weeks, learning to cut into people's brains, to remove tumors, to hold someone's life and death in your hands. Paul was extraordinary. He'd studied literature before medicine. He wanted to understand what it meant to face mortality. He'd had hundreds of conversations with dying patients, explained prognoses, helped people prepare for the end. He thought he understood death. But understanding death from the outside is completely different from facing it yourself. Spring 2013, Kalanithi started having back pain. Then he began losing weight rapidly. He'd lost 40 pounds. He had night sweats, crushing fatigue. The symptoms were textbook. There's this strange denial that happens. You think, not me, I'm young, I don't smoke, I'm healthy. Finally, in May 2013, he got a CT scan. He should have been operating on other people's tumors. The scan showed his lungs were riddled with cancer. Stage 4, metastatic, the kind he'd seen kill patients within months. Paul Kalanithi, neurosurgeon about to finish his training, was looking at his own death sentence. Overnight, everything reversed. The doctor became the patient. The person who gave bad news was now receiving it. He was lying in a hospital bed at Stanford, where he'd worked for years. His colleagues were now his doctors. Paul could read his own scans, understand his prognosis. Stage 4 lung cancer, median survival, 8 months. Most patients have the mercy of not fully understanding. Paul understood every detail. It was a terrible knowledge to carry. Paul and Lucy faced an impossible question. How do you plan a life when you don't know the time? They decided to have a baby. Most people with terminal cancer don't start families, but Paul said, if I'm going to die, I want to leave something behind. Paul started aggressive chemotherapy. The treatment bought him time. The tumors shrank. He felt well enough to do something remarkable. He returned to surgery. Between chemo treatments, while his body was being poisoned, Paul was operating on other people's brains. He was removing tumors from other people while tumors were growing in his own body. It gave him purpose. In July 2014, their daughter Katie was born. Paul held her knowing he might not see her grow up. But he had one more thing he needed to do. Paul began writing. Even as his body failed, he wrote about the view from both sides. He wrote about how different it is to face death as a patient versus as a doctor. Now he understood it from the inside. The book was called When Breath Becomes Air. It chronicled his transformation from doctor to patient. In his final months, as the cancer progressed, Paul raced to finish. He wrote about meaning and purpose. He completed the manuscript just weeks before he died. On March 9, 2015, at age 37, Paul passed away. The book was published posthumously in January 2016. It became an instant phenomenon, translated into 40 languages. Paul gave us something no other physician-writer had quite captured, what it's like to have all the medical knowledge but none of the power. His book changed how doctors talk to dying patients. Medical schools now teach it. Oncologists read it to understand. Paul spent years preparing other people for death. When it was his turn, he learned all that preparation wasn't enough. But he wrote it down. The neurosurgeon who held others' mortality in his hands held his own with the same grace and courage he'd counseled others to find. Next episode, the immunologist's autoimmune attack. Dr. Mark Davis gets long COVID and studies his own malfunctioning immunity.